Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
I learned about severe lows as a teenager. Maybe I kind of blocked that out because, as a teenager and sometimes as an adult, I don't want to believe in my own mortality or my own vulnerability. But when it happened to me firsthand, there's no denying that severe lows are possible. My first severe low, I was 15 years old. I was at a diabetes conference. We were just running around playing sports. My blood sugar went really low, too low, and I had a hypoglycemic seizure there at the conference. I did not have a plan in place for a severe low. Fortunately for me, there was a mom walking around. She had the glucagon kit on her, but she was afraid to use it. It just makes me wonder, what good is that medication if you're too afraid to use it in the exact time that you need to? As a diabetes educator, I like to keep up with the latest and greatest technologies and therapies and medications. So when I heard about Gvoke coming out, I got really excited and went to talk to my doctor. I was excited about it for 2 reasons. 1, it's pre-mixed, ready to use. 2, it can just be administered in 2 steps. When I brought up Gvoke to my doctor, she was very excited as well. My second severe low was in January of 2021, after I gave myself insulin for breakfast. My dog was crying at the door to go out, and then when I came back in, the baby was crying. My CGM beeped that I was low, and I was like, oh, sorry, I would just treat with gummies or juice box. And then a few minutes later, I had the alarm go off that I was gonna be urgently low soon, and then had this realization of like, oh no, I gave myself all of that insulin and didn't eat anything yet. I felt awful and I started eating everything that I could find. And then I continued to go even lower, and that's when I grabbed Gvoke and decided I'm going to self-administer this.
Oh, we read the very hungry.
Oh, I like that one.
My wife is a great partner, and I for sure rely on her for a lot of things, diabetes and non-diabetes tasks. When I first got Gvoke, I showed her the pictures on the pouch and I instructed her on how to use it.
It's inside the yellow.
Yeah, so it's in the yellow.
And she agreed that it was something that she could do. But she was feeding our baby. She had her hands full. There's times where she is able to help me, and there's times where it is not gonna be as convenient. So it was important for me to be able to self-administer. I grabbed the Gvoke pouch out of my backpack, opened the pouch, took the cap off, injected into my abdomen, and held for 5 seconds. And that was it. I just had this sense of relief come through.
The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache.
After I administered Gvoke, I felt a little nauseous, but that went away shortly after. It only took a few minutes for me to feel better. I thought back to my experience when I was 15 years old and the mother there who, again, had that kit but couldn't use it, and how different things would have been if we had a pre-mixed, ready-to-use glucagon injection.
Say hooray! Yay!
Self-administering the first time, it changed the way that I think about severe lows because I feel more confident in the ability to treat them. It was really eye-opening for me because I didn't have to wait for somebody else to administer. I could take control of it myself. I take Gvoke with me wherever I go. It's in my little diabetes toolkit, whether it's in my backpack, my travel bag, it comes with me. I think about Gvoke as a fire extinguisher. It's one of those things that you hope to never have to use, but the reality is you need to have it in case of an emergency. Diabetes is frustrating in many ways, but one of the most frustrating parts about it is its inconsistency because you can do the same activity 3 days in a row, you can eat the same amount of carbs 3 days in a row, you can take the same amount of insulin 3 days in a row and have 3 completely different responses. And the unpredictability is why it's important to always have a plan in place. You never plan to have a severe low, but you should always plan to be able to treat them.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke. Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.